Does anyone recognize that music? Oh, that is the theme to Chariots of Fire. And that movie came out in 1981, which is the year that I entered nursing school. My name is Linda Haynes, and I work at Boston Children's Primary Care Center. I'm the nurse practitioner with the asthma program, and I've been delivering care to patients and families since graduating nursing school in 1983. Our clinic at Children's provides care to patients in the surrounding Boston neighborhoods. Many of our families are poor and live in substandard housing, and many have high rates of emergency room visits and hospitalizations due to asthma. Today, I'd like to tell you about one of my patients whose name is Thomas. Thomas is a young boy with poor asthma control. Thomas missed 30 days of school last year due to asthma. He had multiple emergency room visits and one asthma hospitalization. Thomas met with me, and during his visit, he admitted that he'd stopped taking his asthma controller medication for the third time since school began. Thomas came to clinic with his mother, who had mental health needs, and a newborn sibling that was in the home. I met with Thomas's mother after his visit, and she admitted that she was frustrated with repeatedly having to tell him to take his asthma medications. She told me that she was worried about him, but felt he couldn't walk to school in the wintertime if his asthma was acting up. And she worried about him doing poorly in school, but felt that she was powerless to make headway. She also worried about their home being overcrowded and dusty, especially with the addition of a new baby in the home. So most providers would agree that Thomas is high risk. And the days that he missed from school accounted for 16% of his entire school year. The CDC reports that across our nation in 1 year, asthma causes school children to miss 10.5 million school days. So Thomas is certainly not alone. And in our Boston clinic, 15% of the children who come to care have asthma. So how can I care for them all? Early in my nursing career, I learned to view individual patients as made of in many parts, but one patient at a time. Today, we need to care for large numbers of patients and still provide excellent care. This year, as part of an innovation fellowship, I work with Dr. Faye Holder, a senior innovation fellow, to develop an asthma population management for our clinic. This was a 4-step project. The first step involved identifying our patients using the electronic medical record and creating an asthma registry. We found that in our clinic, 2,000 patients have asthma. And of those, 200 are considered high risk based on emergency room visits and hospitalizations. The next step was to determine what interventions are really necessary for good asthma care. We wanted to make sure that all patients who came to care received at least 2 preventative visits a year for patient education and management. We wanted to make sure that there was ongoing asthma control assessment, screening for tobacco exposure, environmental assessment, and that all patients who came to our clinic would receive an asthma plan and an influenza vaccine. These interventions were performed by all members of our primary care team, our nurses, our medical providers, and our clinical assistants. And these interventions occurred at both primary care visits as well as urgent care sessions. The next step in our project was telephone outreach. Our team nurse Sheila has been able to contact patients after they've been seen by the primary care team. She works to identify barriers to them implementing the plan and arrange follow-up visits. In In our pilot period, Sheila has been able to reach out to 300 families in a 4-month period. Other team members that assist in our goals are Maddie, our research assistant, who helps to identify patients who are most at risk, and Esther, our family navigator, who assures that patients can come in for visits and provides flu shot reminders. The fourth component of our plan is care coordination. And last year, our asthma team studied social risk factors that influence patients like Thomas's ability to stay healthy. We determined that 96% of our families have unmet social needs that impact their health. Many of our families have more than 3 areas of need. And the needs can be things like environmental triggers, financial insecurity, housing issues, and mental health needs. These are all-encompassing factors that affect patients like Thomas's ability to stay healthy. And for our parents who come along with their children to our clinic, most of them have no primary care provider of their own. So we are the connection with the medical community. So for Thomas, it was going to be important for us to make a plan that addressed not only his medical needs, but also his unmet social needs that were affecting his care. We do this through care coordination. I met with Thomas as the nurse practitioner, and I did care coordination, care management. I was able to meet with him every 2 months, and I worked to engage and motivate him to take his asthma controller medications. I worked with his mom on asthma education and to fine-tune his care. I was able to advocate for transfer to a slightly larger apartment so Thomas would have the space he needed to reduce dust and clutter that was impacting his breathing. And I enlisted the help of the social worker on our team for resources and for parent support. Well, this year Thomas is doing a little bit better. And for our high-risk patients, we've been able to decrease emergency room visits by 50% and hospitalizations by 45%. We have community outreach programs for influenza vaccine and spring allergy care, and we hope to pilot group visits for family support and education. We are entering a new era of medical care where we must continue to provide excellent care to individual patients. But we must also care for large groups of patients based on their individual needs and risks. Population management will enable primary care teams to optimize care at all delivery levels and all risk levels and provide high-quality asthma outcomes.